webinar started. Thank you everyone for joining.
Good afternoon, everyone. Thanks for joining today's seminar series.
We'll give a few minutes for the room to get populated and folks to settle in. So welcome, happy Tuesday. It is March 25th. If you're joining us, you're here for FCI's monthly scientific seminar series. We'll give a few minutes for folks to be able to trick in the room, settle in, and adjust their audio settings. Today, Dr. Sally will be presenting, and we'll pass it over to her momentarily. Okay, we'll give it like one more minute, Dr. Sally, before we get started. I see folks still.
Trickling in. Yeah, and I know it's spring break for a lot of people, so I know it won't be as big as a crowd as usual, but thank you everyone who's joining us today.
Are you kidding me? I would sign up to learn about our toolbox anytime. Doesn't matter if it's spring break or not. Even kids should be learning about about toolbox talk. Okay, so if you're just joining us, give us a few more seconds. We'll let folks join in and optimize, and then we'll start our presentation. Okay, it is 1:02. So why don't we go ahead and get started? We have a nice healthy group of folks joining us for today. So good afternoon. Today is Tuesday, March 25th, 1 p.m. Eastern Standard Time. You're joining us for our Firefighter Cancer Initiative monthly scientific seminar series. So this month, we're joined by our very own Deputy Director of the FCI, Dr. Natasha Schaefer. Oftentimes, we get asked when we're out in the field about strategies and tools to help fire departments and fire stations with cancer control, right? How do we help prevent and have conversations about cancer? So Dr. Sally and her research team have been working to develop a toolbox with those tools in one particular place. So we'll spend this afternoon, asking, learning a little bit about the project, get an update on there, and then be able to ask her some questions. Remember, we're using a seminar series format here, so any questions you want to ask her, please feel free to put them here in the chat, and after the presentation, we'll be sure to ask her. So I'll pass the baton over to Natasha. Will teach us about firefighter toolkit.
Great, thank you. Thank you for the great introduction, and thank you all for being here. So I'm very excited to share with you some of the work we've been doing this year in this reporting period on education. And so education, we know, is such a key part and a big part for our first responders, not only on cancer prevention, but all other health concerns as well. And so we've done a few things that we've been able to really educate and re-educate our firefighter community. And so I'm going to talk to you about a little bit about our curriculum and where we've been the last few months, but then really touch base on this new program that we are launching this month, Fighting Cancer on the Front Lines, a collaborative toolkit for firefighter health and prevention through education. And so I will share with you the opportunity for you as first responders to work with us as scientists and how to share education and increase prevention throughout the fire service. So today, really straightforward. We're going to go over our curriculum and then go over the toolkit and the initiative that we're putting together. Before starting, always acknowledge, the our partners and our funding. So the state of Florida appropriation, NCI, National Institute of Health for our P30 grant, as well as funding through FEMA, where without these fundings, we would not be able to do this work. So just to bring you for those who may be new or, our longtime friends, just to see overall the 6 programs that make up the Firefighter Cancer Initiative, that we are made up of several different projects and several different programs. And so today we're really going to focus on our cancer screening education survivorship program. And so with that, there's several things that go into cancer education. One being our curriculum. And so when we started, we really focused on creating a curriculum that can be taught to those who are becoming firefighters. So those who are in fire academy and training, so they can learn about cancer in the fire service before they're even on the job. And so we've continued to do that. And we've continued to partner with the State Fire College, making sure that anyone who is new becoming a firefighter learns about the risk of cancer and how to mitigate those risks. What we've also learned is that it's really critical for firefighters not only to be educated, but to be re-educated throughout their career. And so with our curriculum, we've been able to go to different stations throughout the state of Florida and even nationally to share this curriculum. So I want to go through first the objectives of our curriculum. So it's really to give participants that hands-on experience with cancer prevention tools, learning about education, but also having resources and identifying the gaps that they may have in their current trainings related to cancer in the fire service. And so when we start this, our curriculum and when we're out teaching, we really teach about the hierarchy of controls and how that can be applied to firefighters. So obviously, when you're going down, as you can see in an upside down triangle, the first thing that you could do is eliminate work conditions that could threaten the safety and health and well-being of the worker, or in this case, our firefighters. So obviously there are some things that we cannot do to eliminate. Obviously, we cannot eliminate certain exposures and certain things that happen to a firefighter in their daily work, for instance, a fire or diesel exhaust. But then we think about things of how we can change to help their health. So like, what can we do as a substitute, or what can we do to redesign their work environment? And then moving to how we can educate for safety and health. And so that's really where we're focusing on. But then it's part of our education. We bring up ways of how they can look at redesigning, substituting, or eliminating certain things within their work environment to promote their well-being and overall safety and health. So here you can see is our online portal for our curriculum. And so this allows someone to log in. Here's our QR code. You can log in here. This is free to everyone who wants to use it anywhere in the world. And what you do is you sign up, you have a registration, and then you're able to go through our entire curriculum. And it really depends on the department and what your needs are. For some departments, they really like this model where they can use this, share the link with their members and have them go through the modules themselves. The other way is that we can actually come out to your department and provide education with one of our team members. So we can give the in-person delivery through these learning objectives that we go through in the curriculum. So one, defining the scope of cancer burden in the fire service. 2, to identify the firefighter's occupational cancer risk. 3, which is, probably the most important, is describing how we can reduce those behaviors and their risk and providing tools. So not only those that are, at the organizational level or the fire department level, but more so at the individual level. So modifiable risk factors such as diet and exercise. And then we go into more identifying organizational level changes, and then describing and providing resources for our first responders. So during these self-learning, if you are taking the curriculum individually and you go through our curriculum, there are videos. There's multiple videos at each of the through each of the modules. There's evaluations throughout the modules, and then also we have different activities that you can click on, so it's interactive, as well as case studies. So I mentioned there is a way that, with our team members that we can go out and deliver it. We've been very fortunate this last year. We have a new team member, Chelsea Kavanaugh, who is a certified health education specialist and background in working with firefighters, who is in Central Florida near New Smyrna Beach. So has really been able to help FCI as far as hitting other places that are not so close to South Florida in a more timely manner. So she was actually just in Deltona. And I say this because if you are interested in having your department have our team come out and you think it's maybe too far from Miami, we do have someone centrally located. We also have a new firefighter liaison who is a retired firefighter who's joining our team, who will also be making same thing, station visits or department visits to provide this curriculum and to give actual classes. So, we're really working to divide our team up strategically throughout the state so we can hit more than one place in timely manner. So it's nice because, just last week we had Chelsea in Deltona, we had myself and the clinical team in Hialeah, and then we had our research team actually in Broward County enrolling for another research study. So it's a great way that we can all be working at the same time and enrolling in different projects. The other thing that we can do for the education with your department is work with Target Solutions or Vector Solutions to get our curriculum on your modules that you do with your department. So I just wanted to share some of the cancer prevention strategies that we really focus on. I'm not going to go through the curriculum today, but these are kind of the takeaways that come out. And so, from an individual basis, what we really stress is, having annual physical exams, including really a comprehensive history, physical exam with laboratory testing, and really assessing all body systems. In addition to your annual physical exam, having cancer screenings, we follow through our clinic and our recommendations from our clinical team. We base our screenings off of the American Cancer Society, the U.S. Preventative Service Task Force, and NFPA 1582 standards. We believe that cancer screening should be tailored to firefighters based on their risk. So there are certain cancer screenings that firefighters are eligible for at an earlier age because of their risk, because of exposure, the same as if they were to have a family history in that type of cancer. We promote healthy nutrition and weight with our healthy weight and balanced meal, limiting sugar and processed foods. Another opportunity for nutrition is being part of our nutrition study, which is really just a one-time survey and an assessment of your overall nutritional, physical activity, and sleep status that we can provide feedback to the firefighters. So that can be part of the education. Included, as I mentioned, physical activity. So promoting that adults should engage in moderate intensity physical activity for 150 to 300 minutes per week. Avoid risky behaviors, so no tobacco or drug use, limiting alcohol consumption, and wearing sunscreen regularly. And lastly is good sleep hygiene. So we know that it is difficult for a firefighter to get great sleep, but as much as we can promote a healthy sleep pattern and how you can find ways to sleep when you're off and to really take advantage of those off days. And so in our curriculum, there's some tidbits and some advice on all of these things on how to stay up to date and to, overall cancer prevention. Our second thing that we, as I mentioned, that we focus on in Module 4 is our organizational cancer prevention strategies. And so things to think about as you as an individual, but also things to bring to mind to your department. decontamination practices, practicing on-scene decontamination, following a fire or hazmat incident, setting up your rehabbing in a cold zone, making sure that you're cleaning exposed parts of your body, hands, face, neck prior to eating or drinking when you're in rehab, reducing transmission. We know that as far as some of the initiatives that have happened statewide, showering within the hour, no gear or PPE in the living quarters, transferring your gear in an airtight container if you're moving into your personal vehicle. Also focusing on washing your safety gear regularly and keeping that at the station. So having a second set of personal uniform, using that washing machine for all station clothing and keeping it at the station, not bringing it home. And then moving to your consistent use of SCBA and PPE. We've really been focusing on this, especially with our different subgroups. So whether it be a fire investigator, a wildland or WUI firefighter, consistently and remembering to wear SCBA and PPE correctly during all aspects of the fire, including overhaul procedures. And then the last two are really critical, and we've seen this in the research we've found with our annual surveys of asking department leaders and department members where they see the most change happen and what elements have created that change. And one is having established policies. So learning to develop and implement written policies for cancer risk reduction activities. I think a great resource is working with the Florida Firefighter Safety and Health Collaborative. They have a lot of policies that have already been created and used by other departments that if you don't have a policy that you want to implement, you're able to use what they have listed on their website. And lastly is having a health and safety officer or committee. And it doesn't necessarily have to be called that, but someone that is dedicated to advocate for cancer prevention activities within your department. And so we've, like I mentioned, in surveys that we've done, because we've received the feedback that, well, I'm not able to make change in our department because we're a small department, or, we don't have the funding as some of the larger departments. What we've seen is these two factors are really the key things if you want to see change, specifically related to cancer prevention strategies. The other thing we focused on, and something that we changed recently, so you guys know about the decontamination buckets that have gone out throughout the state, and we've been assisting if people need refills with those, and how they can contact the state. But what we did was we actually just redid this field operating guidelines, provided a little more information, things that we've learned along the way. When we started this and we did that back in 2018, things have changed. And so we wanted to make sure that we are providing the most up-to-date information, and we've been able to modify this FOG and share that as well. And so we can also share these with anyone who's on the call. And then there are QR codes on there that include the videos that go along with the decon procedures. The next thing I wanted to share are some of our resources and tools that we've created based on the needs of firefighters and based on the cancers that we see high incidence in. And so I'm showing you these so you can see where they'll fall later in the toolkit. But we've created about 10 different ones related to different cancers, about different risk factors. And in the last year, because of feedback that we received from not only firefighters locally who are traveling abroad, but also firefighters from abroad who have been asking us for the same information, but translated into Spanish. And so we've done that here. So for all of our educational materials, they've all been translated in Spanish, and we are working on translating our curriculum as well. The other thing I wanted to mention related to our curriculum is not only are we educating our firefighters and our first responders, but we also realize that it's really critical to educate our healthcare providers. So many of them may not have studied occupational health in great depths and don't realize that firefighters are at a higher risk for cancer because of their job. And so we've created a curriculum for healthcare providers so they can learn about the risk and also what questions to ask, what they should be doing during an exam for firefighters, what things they should be ordering. And we've also created the health screening passport that gives them a rundown of the front has a summary of the IARC monograph and shows which cancers firefighters are at elevated risk for. And then on the back shows a screening guideline and timeline of when male firefighters and women firefighters should be screened and which tests they should be screened for, which has been going really well. And then now moving on to our toolkit. And so this was about 2 years ago that this came up that again, from our advisory board and our firefighters who said, you guys are doing a lot of really great work, a lot of studies, a lot of things on screening, a lot of things on education, but it'd be great if we had something that's in our hand, like something that we can look at and have access to at a moment's notice. And so we've created an online toolkit. It's a mobile app that's wrong way. That is free and you can download it here. You can go into your app store and search Firefighter Cancer Initiative, or you can do the QR codes that are listed. And it takes you through everything that we have and everything we've done. So it gives you an overview. It includes all of our team members. Let's say you heard one of our seminars, something on PFAS exposure, but you don't remember who it was, who gave that talk. You're able to look it up with their email address. You're able to see which research projects are active and which research projects you personally or your department may be eligible for. For instance, I was talking about the nutrition study before, and this actually happened just recently, and a department heard me talking in a presentation and reached out and said, I saw the information about the nutrition study. I'd love for our department to be a part of that. So this is a place where you can look these up. You can see all the projects that are going on. And reach out to whoever the project lead is on that. The other thing is our education curriculum and materials. So the PDFs and posters I just showed you, as well as any of our videos, all of that is there. The entire curriculum is there for download, and everything is right there in the palm of your hand, which has been nice because with the PDFs, maybe someone doesn't print something out or check their email, but you can take a screenshot and text it to everyone at your station so they're aware. The other critical thing that we have in the toolkit is for someone who may be diagnosed with cancer or needs to get screened for our clinical team and what to do. So it gives a little bit of a what to do if you're diagnosed, puts you in touch with our nurse navigator. And it doesn't have to be that you are diagnosed with cancer. It could be, I'm at the age where I need a colonoscopy and I need to know who I should call and what I should do. Our phone number is there where you can reach out to our navigator who can assist you. And then also, if you are diagnosed with cancer, it's not only something that's for local firefighters. It is if you are anywhere in the country and you reach out, we can assist you. And it doesn't mean that you have to come to Sylvester, but let's say you live in in Texas, and we have connections with San Antonio and the Mays Cancer Institute. We'll be able to put you in touch with someone that lives near you. Same with really any state that has a designated cancer center near them. We would be able to find a connection and navigate you there. Also, with our resources and our FCI collaborators, we have several of the firefighter organizations that we've been working with from the get-go, including the Firefighter Cancer Support Network, the Florida Firefighters Safety and Health Collaborative, the IFF, your local. So there's contacts there and kind of a what to do next if you need other resources. And then, of course, we have our upcoming events, including seminar series, symposium, and any other outreach events that we may be doing. So we've had a total of 776 downloads, as you can see, throughout the country and even internationally as well. So we share this with you, and I encourage you to share it with your members. It is something nice to have, even if you're not checking it on a daily basis, but if something comes up, you know exactly where to look. We're updating it on a regular basis. And there's also push notifications that you may get as reminders for, certain screenings and just education all around. So now I want to pivot. Now I've told you a little bit about what we've been doing the last few months and, for some of the curriculum for several years, a new initiative that we are looking to launch this year. And it's called Fighting Cancer on the Front Lines, a collaborative toolkit for firefighter health and prevention through education. So if some of you are at the symposium, you may have seen this box that was sitting at the front table when you walked into the main ballroom. And maybe wondered, what is this toolkit and why is it there and what's in here? So again, through feedback we received is, as many of you know, we did the Torches last year, the Torches Fellowship, where we picked 2 firefighters to work with us, learn research, become citizen scientists, and put on a research project of their own, which worked amazingly. And many people had reached out. We actually had way more applications than we thought than we expected, that we had to turn a lot of people away, that many firefighters are really interested in being part of research and being part of the FCI team, and learning about that. And so we kind of pivoted and thought about how we could do something to incorporate more firefighters to become citizen scientists, that's equivalent to what we were doing for Torches. And so what we came up with is working together with the physical toolkit. So we've created everything that is in the online toolkit, the app, and more, into physical things that are put into this toolkit. So this includes, you can see if I go, around the circle, we have shower hangers that have testicular and breast exam directions that can go in the showers at the stations. We have magnets that have the contact information of our clinical team for navigation, with 305-243-FIRE. We have our cancer screening posters that I just showed you. We have our sunscreens that we would put in there in bulk so that it can be shared throughout the department or throughout the stations. We've created a tailored recipe flip book for our firefighters for large, healthy meals. And then our screening guideline, and then also our FCI navigation, what to do at diagnosis. And so putting this all in here, so what happens next? And so we're looking to conduct an outcome evaluation of the Cancer Initiative Resource Toolkit and see the feasibility and acceptability of doing a train the trainer model. So we're looking to do really an application process similar to how we did for Torches. So the idea would be that we would recruit and enroll 10 fellows for this, and that it would lead to the enrollment or education of over 500 members for the study. And so we would expect that those fellows would devote about 10 hours per week in the fellowship program. They would train with us as the FCI scientists to learn the ins and outs of research, as far as, complete a city certification, learn about the actual education, the actual cancer prevention curriculum, and then how to actually deliver that and deliver the education to their department. And so our idea is that each fellow would receive 5 toolkits that they would then take to each of their state, 1 kit per station within their department, and would educate each members of that station with everything that's in the toolkit and about cancer prevention. And so I'll go through this with you a little bit. Here's a little bit about the application process. So we would ask for, a current CV, a one-page personal statement, a letter from your fire department and your union that that they're allowing you to do this. So the important thing is that you would be stating that you would be allowed to make station visits to deliver 30-minute cancer education sessions to on-shift members. Because that's a really important piece. We want to be able to make sure that our fellows are able to share the cancer prevention education. And so we want to make sure that it's cleared by leadership ahead of time. And then in the personal statement, asking what motivates you to be a part of this education fellowship, and if you have any experience, and you don't have to have any experience in research, but it's just for us to get a better idea of, why you want to do this and why is this important to you. And then we will get, each application will be peer reviewed, similar to how we did with torches. And then we would move on, once they're selected, we would notify the participants, and then we would start the training process. So here's just a little bit of a breakdown of, where we see our study procedures, having, gauging the interest of our potential fellows. That's currently where we are now, sharing this information, putting out the application. Once applications are submitted and selection is completed, then we would really start the training. So our phase 2 would be really training what we consider the fellows or the trainers. And then after that, our phase 3 and phase 4 is really our fellows going out there and giving the education sessions. Part of that is not just giving the education sessions, but learning about, giving the pre and post evaluation, because what you will be doing essentially is running your own research, but it'll all be one research project together instead of separate research projects. So after completing the physical toolkit training, each fellow will be able to explain the excess burden of cancer in the fire service and FCI's education efforts. You'll be able to outline the role and responsibilities of a firefighter partner or fellow participating in this study. You'll be able to deliver cancer prevention training to firefighters, and you'll also be able to implement the toolkit and distribute cancer prevention resources to firefighters. So it is something, as I mentioned, that you will be trained. So there'll be 4 main sessions of training, but there will be regular follow-ups after that, just to check in to see how each of the sessions are going within your department. But to give you a little bit of background, there's session 1, which is an intro and background to the entire curriculum, what you will be teaching. 2 would be your role as a cancer education fellow. 3, cancer prevention training. And then 4 would be in person, and it would be the FCI physical toolkit training itself, which would be a really hands-on run through. So I'll go through each of the session, and then I'm sure there'll be questions coming up about it. But this session 1 is really an overview of FCI, our education projects, and then cancer in the fire service. So it's really important that you're able to answer, general questions about prevalence and cancer risk and what are the common types of cancers, because these are things that are going to come up during the education session. And then the latest IARC monograph, as well as the FCI physical toolkit study overview. So this is our first session. We'll go over all these things. We really want the fellows to understand that it would be just giving a 30-minute sitting around the kitchen table talking. We don't expect it to be a formalized, with a PowerPoint. We really want it to be a conversation, and for those first responders who are receiving it to see what the resources are, what's in the toolkit, to have those conversations, to start those conversations, so we don't just go to a class and then forget about it. We want to keep it, on the top of everyone's mind. So, session 2 is really your role as an education fellow. learning the value of community science, and then what your roles and responsibility would be as a fellow and really a researcher with us, a citizen scientist, as far as recruiting the firefighter participants, obtaining consent, delivering the training intervention, providing feedback on the toolkit. And these are all things that we will train you on and be there, during all the steps. We will be teaching here the principles of research ethics and city training. So really all the training that a lot of our research staff goes through, because you will be handling data. And then learning about the support that you'd have from FCI, guidance, technical support, and then on-site assistance. We would obviously, go with you on site for the first trainings. Session 3, we really focus on the nuts and bolts of the curriculum. And so things that you would want to know about, and we would be creating a manual for our fellows to know when people ask questions about non-modifiable risk factors, work-related exposures, and then moving into modifiable risk factors. So going through each of the steps that we already have in the curriculum, but being able to go through that in a little more detail with each of our fellows, so you're able to answer those questions. And then learning about the different resources. So these are all things that, again, I mentioned are part of the curriculum, but really sharing it with each of our fellows so they're aware of it. And then lastly is our physical toolkit training, and it's really going over everything that's in the toolkit and then doing intervention delivery. And so this would really be a lot of mock training sessions that we do in person, making sure you understand how to collect the evaluations pre and post, going through the facilitator manual, really a lot of the logistics. But I think probably the most important piece during all of the training, because we know, you learn most when you're doing it hands-on and you're practicing and you're able to ask questions. So this is probably, one of our most important pieces of our toolkit training. To share with you, this is based on, theoretical basis and looking at the health belief model. So when we're doing our pre and post evaluation, we are looking at what the education will do for them, what are their perceived benefits or perceived barriers, and where do they see their efficacy, and where do they see their cue to action. So these are things that will be tied into the pre and post evaluations, but just to share with you that it is based on a theoretical model that we've put together. And so then here, this is what I was talking about with our pre and post surveys. We'll be assessing these constructs. So where do we see, an example, working as a firefighter, does it make you more likely to get cancer? So assessing their perceived susceptibility, assessing their perceived severity. If I get cancer, my whole life will be negatively affected. Is that something that their perception? So these are things that we would be assessing throughout the entire project. And then, of course, a survey to assess the usability and acceptance of the program, the materials, and it be given through a train the trainer model. So lastly, just to, finish up here is our next step. So our review of applications. We have shared, and I can share again, the QR code. We will also be sharing through email and social media the flyer for those who are interested. And we will close the application portal the end of April, and then we will start our training sessions right away in May to then go to the next phase of the intervention of enrolling firefighters and educating them. This is open to not only Florida, but anywhere in the country. I know that will probably come up, but we are open to do those trainings. As you saw, for our fellows, the trainings are majority online and virtual, except the fourth one. So we're willing to, pay travel for someone to come for the in-person training for that fourth training. And so with that, I will stop sharing and open up and see if there is any questions.
Thank you, Dr. Solle, for a great presentation regarding fighting cancer on the front lines, an overview of the physical toolkit. We have one question so far. For the FCI Fellow Training Program, do you need to be in Florida to apply?
Great. So yeah, so I knew this would definitely come up. So yes, you don't have to be in Florida to apply. It is open to anyone throughout the US.
Thank you. Any other questions? Please place them in the chat. Okay, I don't see any other questions. Dr. Solle, do you have any final comments before we dismiss?
No, I think we're good. So thank you all for being here. If any questions do come up after the fact, please feel free to reach out to me or anyone on the team. Happy to. Oh, I do see. Sorry.
I have one. What are the biggest?
Go ahead.
Read it.
Go ahead.
Okay, great. What are the biggest barriers you've encountered when trying to implement these cancer prevention strategies at the organizational level?
Yeah, so some of the organizational strategies that we've offered or recommended, I would say it really depends on the department. Some of the barriers include funding a lot of times, depending on what they want to get, if it's either a second set of gear or if it's um, um, a different staging or area to house their gear. But what, we've shared is, always do the smallest things that you can do at an individual level that will then change the culture, of, showering, wiping down. Wipes are not expensive. So, whatever you can do, uh, every small little thing matters. So I think that is the biggest thing. Besides that, I think that has been one of the biggest things from our firefighter partners when we've heard that they couldn't make change.
Okay, great. We have one more question. Fellowship. I am a statewide coordinator for FF Health and Safety. I'd like to recruit multiple local firefighters from different departments throughout Oregon. Is this possible, or would it be better to have a single statewide fellow at this stage?
I think that I would have whoever is interested apply, and I think it's going to be a peer-reviewed application process. So I don't want to say that we would pick only one. I think if there's more than one, that's a great candidate, and they're both from Oregon, I think that's fine. So I wouldn't say like only pick one at this stage, but I think anyone who is willing to do the work and put the application in and fits it, we're happy to review it.
Who is your ideal candidate to be a fellow for the program? Rank/position, currently enrolled, grad, undergrad, etc.
Great question. And I really think it comes from someone that's motivated and that this is important to them. I don't think ranking or position is critical to us at all. Initially we had said, maybe we open this up to health and safety officers, but speaking with more firefighters and realizing you don't have to have the title of health and safety officer or prevention officer. If you are someone that is is passionate about this and cares about this and wants to learn, I think that's the best candidate, someone that this is important to, because they're the ones that are going to put the effort in and make sure the stories are told. So I don't think it has to, they don't have to have a graduate degree or an undergraduate. It's more so why it's important to them and why being a fellow would help them and their community.
Great. And I have a question for you, Dr. Solle. When can we share the application process with everyone who would love to join? Is it open now?
It's open. Yeah, we were waiting to present it here, but Kara, who is our social media person, she already has the information. She's going to post it on our social media. We can follow up and share the flyer after this. She's also including it in our monthly newsletter. So if you are not part of the monthly newsletters and would like to, feel free to reach out to the FCI email and we can add you. But yeah, it's live now.
Okay, great. Thank you. So we don't have any more questions. Do you have any final comments?
No, I think we're good to go. Thank you everyone for your time,
Thank
and we will
you.
see you next month. And looking forward to next month's presentation.
Thank you,
Take care,
everyone.
everyone. Bye-bye.
Have a good day.